did actually. So the next station going for Dr. Bushra. Dr. Bushra.
Yes, sir.
Okay, so you will have 2 minutes to read your scenario. Then your role player will appear and you will start your 10 minutes. Start, please, reading your scenario. Please, before starting, just 1 second. Before starting this case, alarming signs for a patient with a domestic violence or a colleague under pressure. In a domestic violence, it will be a young patient. Most probably, it will be a young patient, one of the vulnerable group. High parity. She will came for booking late after 12 or 13 weeks. If you ask her about the follow-up, she's missing her appointments. She's complaining of vague complaints. All the tests are normal and the complaint is vague. She smokes and drinks alcohol heavily. She's living with someone who's not the father of the previous children. Not interactive. She will try to avoid eye-to-eye contact. She will look everywhere. She will look to the floor. Her body language will give you a clue that there is something wrong in this station, and she's in a hurry to go because her partner is waiting outside and he did not attend the consultation with her. Remember the HARC screening tool. If you are suspecting that this is a domestic violence, you have to ask about the HARC. H for humiliation, A for afraid, R for rape, and K for kick. So humiliation. Within the last year, have you been humiliated or emotionally abused in any other way by your partner or your ex-partner? I hope my voice is clear because I have a common cold and my nose are blocked completely. So excuse me if you find some letters are not in the proper way. So number 1, humiliation. A for afraid. Within the last year, again, within the last year, have you been afraid of your partner or ex-partner? R for rape. In the last year, have you been raped or forced to have any kind of sexual activity by your partner or ex-partner? K for kick. Within the last year, have you been kicked, hit, slapped, or otherwise physically hurt by your partner or ex-partner? So these are the points. This is the screening tool for domestic violence: humiliation, afraid, rape, and kick. Take care in cases of domestic violence or these scenarios because it may be a depression or an anxiety station. It may be a mental health problem station. That's why you have to ask about the mental health. We know the screening questions for depression and the screening question for anxiety. For example, it came once. One lady, she was coming, she was not interactive, she was trying to avoid the discussion, all the criteria of domestic violence. But when we reach to the family history, she told that her twin died 2 months ago in a car accident. So the scenario was completely twisted. In this station, you have to twist your performance. Instead of domestic violence, you will go for condolences and immediately ask to estimate the severity of depression, how she's feeling now, if she's trying to hurt herself, and if she needs help with that, and you will overhear counselor, you will overhear perinatal mental health specialist experience in such cases. So if you find this scenario, please don't forget to ask about the family history and the mental history, especially for depression, to exclude the possibility that the case may be depression. This is just a few notes before starting. Dr. Bushra, now you can start again, please. Okay. You have 10 minutes, Dr. Bushra. Please open your camera, please. Dr. Bushra. Okay. Now you can start the 10 minutes.
Hello, I'm Dr. Bushra, one of the doctors in the clinic. May I know your name and age?
I'm Susan, 35 years old.
How may I address you?
You can call me Susan.
Okay, Susan, I have gathered from your notes that you have been referred by your midwife as you're 30 weeks into your pregnancy and now you're having pain in your tummy and vaginal leakage. Is that right?
Yes, doctor.
Okay, Susan, any other expectations you have from this discussion today?
I'm having abdominal pain and my water is leaking.
Okay, Susan. I will address your complaint shortly, okay?
Okay.
So, Susan, but before that, I discussed with you your management plan. As I'm meeting you for the first time, I need to examine you in the presence of chaperone. I will do some tests on you. And before that, I need to ask you a few questions to know more about you so that we can make a safe plan together. So, is that okay with you?
Yes, okay, doctor.
Okay, so Susan, please tell me more about your pain.
Doctor, it is, I cannot do work. I have so many responsibilities, but all the time, this pain. And I tell to the midwife and she refer me to you. I don't know why I'm having this pain.
Yes, I can see that you are so worried about your pain. So, is it continuous or it comes and goes?
No, doctor, it is continue. All the time I'm having this pain. My back pain,
Okay.
my lower tummy pain.
Okay. Any associated vaginal bleeding?
No, doctor.
Okay. And how's the movement of your baby?
That is okay.
And any problem with your bowel or water works?
No, that is okay.
All right. And Susan, tell me, how has been your pregnancy so far?
My pregnancy is good.
Okay. Did you had your regular visits?
I'm so much busy. I have my 4 kids. I have to take care of them. How can I come regularly? Not possible.
All right. And did you had your ultrasound and blood test done?
No, doctor.
Okay. May I know why?
Doctor, my husband is waiting outside. Please, can you just write medication for me? I will go because he's waiting.
Yes, I can see that you are in a hurry, but for your better management and for your treatment of the pain you are having, we need to talk more about your problem and also need to examine you in the presence of chaperone, okay?
Okay, doctor.
Okay, so Susan, tell me about your smears. Are they up to date and normal?
No.
And may I know why you didn't had your smears?
Doctor, I told you I have kids at home. I'm a housewife, so many work at home. I didn't get the time.
Okay, and tell me, as it's your 5th pregnancy, tell me more about your previous pregnancies.
All were good.
Okay, and tell me, are you seeing your GP for any medical problem?
No.
Did you had any surgery?
No.
Do you smoke, Susan?
Yes, doctor.
So, have you ever thought of quitting?
No, doctor. It gave me relief. I like to smoke.
Okay, but Susan, smoking is not good for your health. So if you ever thought of quitting, I will give you the contact numbers when it is Stop Smoking Services, and they will be helpful for you. Okay.
Okay.
Okay, and do you have any allergies?
No.
Okay, and what do you do for a living?
I'm living with my husband.
And how is the support?
Okay, he's good.
Okay. I'm sorry to ask, but could you tell that is he the father of your children?
No, doctor. This my 4 baby from my other partner. This one
Okay.
is this husband.
All right. Susan, before we discuss about your pain and further management, your midwife has some concerns regarding bruises on your body. So could you please explain that to me, that what happened?
No, doctor. I just fell down from the stairs. So just because of this, I have this.
Okay.
Process.
Okay. Right. But Susan, I just want to assure you that whatever we discuss here will stay here. Okay. And whatever we talk about will be kept confidential unless you want to disclose that to anyone else. So you can talk to me about anything. If you have any problem, any issues, you can talk about it. You know, Susan, many women in pregnancy comes and they are suffering the abusive behavior of their partners, and they are very reluctant to talk about it. But when they talk about it, they feel more relieved, and help is also available. So it's very helpful to talk about it. Okay, so it's nothing unusual, and we are here to help you, and we are here to support you. So if you share with us, things will be easy for you.
Actually, my husband is shouting on my kids and on me. Sometimes he hits me. Yesterday also he hits me a lot.
I'm really sorry for that, Susan. I'm really sorry for that. But you have a right to speak, and you shouldn't have suffered in silence. So we are here to help you, and we are here to support you. Okay.
Okay, doctor.
Okay. Do you feel unsafe to go home?
No, I want to go home, no problem. If he hits me, my kids are there. I want to go for my kids.
Any threat for your kids?
No, he is not hitting my kids. Sometimes he get angry on them and shouted on them.
Okay, but I will connect you with the safeguard services. Okay, they will talk to you about how to care for your kids, and how you can. I will also, after the discussion, ask the safeguard midwife to come and talk to you, so she can discuss further about your plan and how to deal with the situation. Okay.
Okay, doctor.
But few things, yeah, Susan, few things I want to tell you. That you should keep a bag ready with your important documents at a safe place, right?
Okay.
Okay. And you should also have, I will also give you emergency numbers in case of emergency, which you can contact.
Okay, doctor.
Right. And regarding your complaints, I will advise you painkillers, and I will examine you to see the growth of the baby, and I will also arrange an ultrasound scan for you to see if the baby is growing well, right?
Okay, doctor.
And I will also give you some written information material about how to seek help and what to do in case of emergency, and the contact details. And I will also tell you of the organization that are helpful in cases. We call this as domestic violence. So they are very helpful for women who are facing these situations. They also provide help regarding housing, regarding if you need any financial help, any employment help. They will be very helpful for you. Okay.
Okay, doctor.
Okay, and I will document this in your hospital file, but I will not mention this in your handheld record. So if you have any concerns, you should seek help immediately regarding them suffering in silence, okay?
Okay, doctor.
And I advise you to have regular visits with us.
Please stay, Asma, please stay. Don't go. This is one of the best stations done in this course or the previous course. Very well acting and very good response, Dr. Bushra.
Yes, true. Yes,
yeah.
true. She was responding very well.
Yes, that's why I asked you to stay. Your tone, your response, your reactions are very well. I hope Dr. Ali will give you the pass mark in all domains. Asma is putting a makeup, even she put a bruise here, huh?
Yes.
Yeah.
So
I tried.
The only comment I have here, Dr. Bushra, you spent 6 minutes to start asking about the domestic violence. You have only 4 minutes to explain all the other points in the station. This is my only comment, but you did very well. Your tone was very nice. You assured her confidentiality. You tried your best. Then the patient was open to you. This is one of the best stations. Maybe I will publish this station as a model station. Okay?
Oh my God.
Okay. So Asma gives you a clue by a bruise here in her forehead. So I think it was a good chance to open early the discussion about the domestic violence. This is my only comment, and the remaining is for Dr. Ali. Thank you so much. Thank you, Asma. You have the Oscar in this station.
Thank you. Thank you.
Okay, Dr. Ali.
Well done, Dr. Bushra. Actually, you have the key success points in this station that your confidence is evident. Your talk is very clear, and you adopt a calm manner through all the station. And this is a key to pass this station easily. You took a lot of time in the history. In the scenario, they wrote that the diagnosis as non-specific vaginal discharge and the midwife is concerned. So yes, you can take the history, but don't go too deep to waste your time. You didn't ask about the mental history. I didn't make this point, but she looked depressed and she looked not responding well for you at the start, and gave a short answer, and she's a hurry. So this should be a clue that you should pick. Is it something, a hidden agenda there? Is there a domestic violence? Is there something she's hiding or she's depressed? So very important, as Dr. Sroor introduced before the station, is to ask about depression questions or anxiety questions. Go domain by domain. You perfectly pass the safety because you ask about her safety at home, you ask about her safety regarding the children, and you respond regarding the children by informing the children's safeguard. You give her the leaflet, but usually they are giving anonymous contact number to avoid the husband to see the leaflets or the number belong to what, so he will not know that she's contacting a helpline. One point you can add in the safety is to ask her if she have any thoughts that the life is hopeless and doesn't deserve to live, because some of these ladies are depressed and have a suicidal thoughts. But collectively, you pass the safety perfectly. Regarding the communications, also you pass perfectly. You were very empathetic. You acknowledge that nobody deserves to be in her situation. You assure confidentiality, and this is the most important part in the communication. It take a borderline if you didn't mention. You give her the plan clearly, but of course the time is ended before you complete it. But initially it was good, and you give appropriate referral. So regarding communication, you pass also. Information gathering, the most important point in the information gathering is to pick the red flag, and you mentioned them. She's reluctant to do any test. She's reluctant to do the smear. She's in hurry to go home. And she has a repeated A&E visits and plus the bruises. Also, she's a smoker. She gave you a clue that she enjoys smoking. So red flags are picked well. The only issue is that you didn't ask specifically about the mood. But it was not in this mark, in this stage. So also you pass the information gathering. Regarding the applied clinical knowledge, you know how to refer and for whom. And this is the most important part in this applied clinical knowledge. But there is one point you should mention also that domestic violence has effect on pregnancy for her and for the baby. She can be exposed to trauma, and her psychological health may be affected. And for the baby, there is a risk of preterm delivery, there is a risk of small gestational age, there is a risk of even stillbirth. So the effect of pregnancy, this was not mentioned, but it was mentioned in the mark, but has no borderline or fail mark. So collectively, we will put this inside your good performance, so you will pass all the station. Thank you for your performance, and just maintain this confidence, calm, clear way in all the station.
Thank you, sir.
Thank you.
Thank you, Dr. Ali. Thank you, Dr. Bushra. Actually, one of the best performance in this hard station. So I cannot add anything else, but remember, if she's unsafe to go home, to offer her admission, Dr. Bushra, okay? Admission is very important.
Dr. Surur?
Yes.
I want to share, in my time, domestic violence was the most fearful station for me, because I don't know how to talk about. I didn't face, I cannot understand at that time. And I was in St. George course in UK. At that time, I failed this station completely. I cannot talk anything. I was sweating all the time. I don't know what to say. Then a professor, actually I don't remember the name, he come to me, he said that is a pre-eclampsia is dateful? Yes, can cause to the mother death. So you are standing and doing nothing? I told no, I'm trying to help her control the blood pressure, and doing so and so and so and so. So this situation here is lethal. It can be end by the mother's life or the baby's life or the children at home. This is why it's very important to us. You know, if you just think about it, and you should ask her by all means to resolve your doubt. And if not, you should tell us, and we can just tell us through the notes, and we can follow this. And if she admit that she has abused, at that time, the next most step is to acknowledge, to reassure her that she's not alone, and this is a common problem in our community. The third step is to say that the safety of her life and or her children, assess this safety is very important. This is the way you can treat her. This is a disease of pregnancy. You know that the domestic violence is more common in pregnancy. So once she's pregnant and you have these suspicions, just go through it. Try to help her. Don't ignore it. And I remember his word till now. So domestic violence is a very popular station. It can come anytime. No course without the domestic violence. Just I want to share my experience with domestic violence, where I was in preparing for my exam OSCE at that time.
So already all these points we answered it here. So tell me more. There is 1 out of 4 ladies in UK. They have the similar experience, and help is available everywhere. If she's unsafe to go home, offer admission. Ask about if there are any weapons at home. If there is any one of the family is treated in a similar way or the children are involved, inform the safeguarding. If she feels that her life is in danger, to call the police or to ask her neighbors, her trusted neighbors, to call the police. Then give her the escape plan. Offer analgesia if she's in pain. Very important, and that's a good point, Dr. Bushra, that you didn't forget the pregnancy and the baby. She's coming. Maybe she's really having a water leak now. And the notes, you mentioned in the notes that it will be written in her notes, but it will not be available for anyone. And you will give her a leaflet, as Dr. Ali said, that contains nothing special for the husband to understand that she told you about the domestic violence she's exposed to and the support. Again, previously we mentioned some charities, and here we are adding some more charities that you have to remember to show that you are one who knows how things are going in UK. So remember, we can give you some contact to some support groups like Women's Aid or Refugee, and there is a 24 hours domestic violence line you can call at any time. Thank you again, Dr.